Well, they say that healthy living is not just an absence of a disease, but it is a complete state of physical, mental, and social well-being. And this being the new year and the new season of our lives, we will understand what healthy lifestyle really comprises, and one of it is maternal health. So welcome to Health Hub Show. My name is Lillian Wanjiku. I'll be your host today. But in the meantime, as you wait for the conversation, please take a look at this fact check. Healthy moms, healthy babies. What does that exactly mean when we talk about maternal health? With me here, I have a special guest. Her name is Dr. Jane Ikonya. Karibu sana daktari.
Thank you.
Yes, karibu. I'm glad to see you. How are you doing today, ma?
I'm doing well.
You're doing well?
Yes.
Yes, I'm so excited about what will happen today. Really ready to learn.
Yes.
Yes, about maternal health.
Yes.
So, but in the meantime, you can briefly introduce who you are, what you do, and why do you do what you do?
Okay, thanks so much, Lillian. My name's Dr. Jane Ikonya. I'm a private general practitioner, a medical doctor, and I'm the proprietor of Plainsview Hospital in Ruiru. So I do my work as a medical doctor, but I have a lot of interest with maternal health.
You have interest with maternal health. That is so exciting. Yeah, you know, I like you're saying this time I've interacted with you in the past.
Yes.
And I remember you saying that women need to give birth like Hebrew women.
Yes.
I don't know what this Hebrew women is all about. I would want you to touch about that a little bit and tell us, what did these Hebrew women do?
Okay. Hebrew women in the book of Genesis, when the children of Israel were in Egypt, there was a command that all the male babies were to be killed at birth. So God made sure that these children were born before the midwife comes.
Wow.
So they had easy deliveries. So when we say our mothers to give birth like Hebrew women, we are saying that they are going to have easy deliveries and get good babies.
I love that, easy deliveries. So we are promised about easy deliveries.
Yes.
Here at Plainsview.
Yes.
I love that. Well, okay, now let's jump into our topic today, because I'm sure the viewers are ready to hear about it.
Yes.
So what does it really mean when you talk about maternal health?
When we speak about maternal health, we are talking about the health of the mother from the time of conception, delivery, and 6 weeks after birth, and the health of the baby from the time the baby is born until the baby grows up.
Oh wow, that is maternal health.
Yes.
So that tells me, let's go to the first thing first. So before all that is happening, so I'm sure we must plan for a pregnancy, right?
Yes.
So that is advisable to everybody.
Yes.
Wow, to couples only though. Or it's for everybody.
It's for everybody.
It's for everybody.
Yes.
Wow. So how do I plan for pregnancy?
So if you're of age and you want to get pregnant, it's always advisable to see your doctor
Okay.
before that, so that if you have any issues of medical health, it can be sorted out before you conceive.
Wow.
Yes.
So basically that is why we need to plan. So do you come to the hospital way before even thinking of, I mean, the moment you start thinking about pregnancy, you just come to the hospital, then talk to the doctor, advise you, and then I'll go and then come back.
That's the right thing to be done.
Wow.
Yes.
So I hope you're hearing, guys. So, and what do I need to do before then? So that's basically what really you've explained.
Yes.
So what's my partner's role in planning my pregnancy? So can you really tackle that? Because I think you being the mother, you don't do this thing alone, especially here in Africa. I think men also need to come in very well.
Yeah, for married couples,
Yeah.
they need to agree
Okay.
when they are going to get their children.
Yes.
So I think the law here is to support
Uh-huh.
to support the mother
Okay.
After they have made that decision,
Mm-hmm.
to support the mother all through the pregnancy.
All through the pregnancy.
Yes.
It is emotionally good.
Yeah, emotionally, socially,
Okay.
and everything.
So the journey becomes easy.
Yes, it's more easy when you have your partner on board.
Wow.
Because when you are alone, there are issues that at times you are emotionally low and you need somebody to help you. So it's very important if it's possible.
If it's possible.
Yes.
So do I need to worry about high-risk pregnancy at this particular time?
Yes, you have to think about high-risk pregnancies.
Okay.
And that's why we are saying that it's important that you see a doctor before conception, because that is where you'll be able to realize if there is any risk for your pregnancy.
And what are these risks?
Let's say maybe the mother has a medical condition,
Okay.
like diabetes, like hypertension. Maybe they have growth of the uterus.
And what are these growth? They are the
fibroids.
Okay.
So if you have any medical issue or any gynecological issue before conception, or before the pregnancy, or even during the pregnancy, that means you have a high risk pregnancy.
Oh, really?
Yes.
So this one is being diagnosed way before, and then now you advised how to go about it.
Yes. So that's why we want our mothers to come earlier, so that if there is anything to be sorted out before conception, then it can be done.
It can be done.
Yes.
Oh, it can be prevented.
Yes.
I love that. That is so good news to hear.
Yes.
So let's go to the next question. I believe these are so many questions people ask outside here.
Mm-hmm.
So what is really conception, Daktari?
Conception is whereby we have the seed from the man, which is called the sperm,
Okay.
and the seed from the mother, which is the ovum. When they come together, and life starts from there. That's what we call fertilization.
Oh.
And from there, then conception comes in.
Conception comes in.
Yes.
Right there.
Yes.
Wow. Then after that, now, do you notice, do you feel the pregnancy immediately, or what happens?
Not really. You may not feel it. But after the growth has started, you start having now some changes in your body that will tell you there's something that has happened.
What are these changes?
Yeah, like the first thing that you have is that you're going to miss your periods.
Okay.
When you expected to see your periods, they don't come. Maybe you start having nausea, vomiting, feeling tired, maybe some headaches.
Okay.
But these things is not for everyone. There are people who feels literally nothing.
Really?
Apart from missing the periods.
Really?
Yes.
And is it true that you can miss the periods after a prolonged, okay, not missing, you can have your periods. Oh, this is spotting something else. I don't know. But I've ever had somebody say that you can have your period and still be pregnant. I don't know how was that? Or rather, that was a special case. And there was another one who completely never had periods, even during time of conception and all that happening. And she still got pregnant. How are these cases?
It is possible, but when you see bleeding when you are pregnant, that one we call it's more of spotting. You're not going to have
The
normal menses or the normal periods.
Okay.
There are people who have a problem with periods. They don't get periods, but at a certain time they can get pregnant, because you see the hormones changes in a way that she can conceive. It's possible to conceive even with a period of no periods, or a period of amenorrhea. You call it amenorrhea. Amenorrhea. Yeah, that means there are no menses.
Oh, really?
Yes.
So, like, so many people are really doing that. Like, they're really experiencing such things, huh?
Not much.
Not
much. Most people have normal menses, and when they go, we expect that you are pregnant.
Oh, really?
Yes.
Wow. But I think these few people are, say, miracles happening or what? This is for menorrhea, the menorrhea people.
With God, miracles are still there.
They're still there.
Yes.
I love that. So,
yes.
Especially anybody who is struggling, and maybe has that kind of an issue, and
yeah, if you are struggling, that's why we said if you want a baby and you come to your doctor, she's going to advise you accordingly.
Wow.
So you don't have to struggle there at home.
Okay.
You need to come and see the doctor, and then she will assist you to know what should be done so that you can be able to conceive on time.
On time.
Yes.
Wow, that is so
you
encouraging.
See, many mothers or many clients, they stay at home struggling with a problem, and they are getting advices from other ladies, and I'm sure they will not get the right advice. So it's always good to go to your doctor and bring your issues, and I'm very sure there will be a solution for you.
There will be a solution.
Yes.
Wow, that is so exciting. So let me ask another question, because we are here to learn, right?
Yes.
I didn't do biology. I didn't like it.
Yeah.
But I'm loving what I'm hearing anyway.
Thank you.
So how long after conception will my pregnancy test to be positive?
2 weeks and above, you should be able to see pregnancy positive.
2 weeks and above?
Yes.
So immediately?
Immediately, no.
Immediately? No, that is 2 weeks.
After 2 weeks after conception.
Okay.
Yes.
So basically that tells me immediate, after that is 2 weeks after you've noticed you're pregnant now, you can come for
a pregnancy test.
Not really pregnancy test. Immediately once you notice that you're pregnant, because I'm sure you've tested for pregnancy.
Yes.
When maybe at home.
Yes.
You've seen the kits that are being provided in the chemist, and so so you're supposed now to come immediately for consultation to really start your prenatal. It's called prenatal
care.
Prenatal care.
Yes.
So let's talk about that, Dr.
Yeah, as soon as you realize you are pregnant.
Yes.
That's the time to start your prenatal care.
Okay.
Because you want to prevent things that can cause a miscarriage. So you'll be the first time you come and see a doctor prenatally, there are tests that you are done, and of course a physical examination has been done, and even a history. So the doctor will be able to tell whether are we dealing with a normal pregnancy or a high risk pregnancy. So I would advise all mothers, as soon as you know you have conceived,
wow,
visit your doctor.
Visit your doctor.
Yes.
Visit your doctor.
Yes.
I love that.
Yes.
So they need to hear that, because I think so many people really don't do that.
Yes.
And what are the risks about that for failure to come, that is?
Failure to come for early prenatal care is that some complications will arise without your knowledge. So that's why we are saying it's very important, because there are issues that can happen as early as early as even within the first or 2 months after pregnancy.
Okay.
So when you come, if you do the testing, the test we usually do for the mothers, if there is a problem, you start solving that problem as soon as you realize it.
That's right.
We also, when they come, we do scans. We do an ultrasound. We would want to confirm where is the pregnancy. Because you can be pregnant, but the pregnancy is not in the uterus. It can be in another place. So we are able to know, we are able to handle the problem as soon as possible. So that's why prenatal care is important.
Prenatal care is very important.
And it's supposed to be as soon as
possible. As soon as possible. Wow, I love that.
Yes.
So you've talked about the pregnancy can be in a different place. Which are these different places?
Okay, when the pregnancy is not within the uterus, we call it ectopic pregnancy. It's something ectopic, it's away from the uterus. The commonest part of the ectopic pregnancy is in the tubes.
Okay.
You know the tube? The tube is the one which connects the ovary and the uterus. So that tube, and fertilization occurs in the tube. So when it happens, and the fertilized egg does not move to go to for implantation in the uterus, then it will grow within the tube. So you can end up having a tubal pregnancy. Another place that can also happen within the ovaries.
Wow.
It can also happen outside or inside the abdominal cavity. Yes. It
can happen.
Yes.
So can somebody die out of that?
Yes.
Really?
You can die, let's say like tubal pregnancy. If it reaches a point where it ruptures, many people die of it if they did not know or nobody suspected they had an ectopic pregnancy. So if it ruptures, you are going to bleed to the abdominal cavity and you can easily lose your life.
You can easily,
if nothing is done on time. Yes.
So there are any other risks apart from that one?
Ectopic pregnancy.
Exactly, that one. Other issues?
Another risk is there are people who get miscarriages. So if you come for prenatal early and somebody realizes you have signs of a miscarriage, then there are drugs that you can give to that mother and you maintain the pregnancy.
You maintain the pregnancy?
Yes.
Oh, really?
Yes.
Wow, that is so good. So, wanafungua fuko uterus or really what?
To do what?
Like, I have somebody that, I don't know what is that, you have to explain to me, had issues with, okay, the doctors on terminate as anemic. I don't know, she was pregnant and she was really struggling until she was to be given bed rest. And then akafungwa sijui wapi the moment isitoke. See, I didn't understand what is that.
Now that is what that is called if the doctor realizes your cervix is loose, we call it cervical incompetence.
Wow.
That is where we come along and we call it a stitch. I think that's what a layman would understand. A stitch, where you stitch now the opening of the uterus or the neck of the uterus, which is called the cervix.
Okay.
But that is done at around 3 months, 3 months gestation.
Oh, gestation.
3 months pregnancy.
Okay.
That's when you do that.
Okay.
But that is for the mothers you suspect their cervix is loose or short. Oh, not for everybody.
Not for everybody.
Yes.
So it's only few people who really suffer such conditions.
Yeah, like if you find a mother who have been getting loss of pregnancies, maybe 4 months, 5 months, those are likely to be having that condition called cervical incompetence. So they will need that stitch when the pregnancy is 3 months, around 12 to 13 weeks.
Oh, so chances of losing that baby is now less the moment you
put the stitch. Yeah. Yes, yes.
So, but you go for bed rest for the whole period?
Not really, but it's not total bed rest. if you have no symptoms and you have been put that stage, you don't have to go for total bed rest, but you don't have to strain. You don't have to do strenuous work.
Oh, strenuous work.
Yes.
So, and how is this losing blood? Not really. Why did the doctor term it as anemic, something of the sort? Or did I?
Anemia.
Yes.
Anemia,
the moment you're losing.
anemia is where you have low blood in your system. That
Yes.
is low HB. So if the mother was bleeding from somewhere, then that would cause anemia. Or maybe the mother had low HB even before she got.
She had.
She had low HB before she conceived.
Ah.
That's why I'm saying early prenatal care is very important, because when you come for the early prenatal care or when you come for antenatal care or prenatal care, there are tests that are supposed to be done. This book is what we usually use to see the tests you're supposed to do. One of the tests that is done is a HB. We need to know how much blood do you have. So if you have anemia, from the word go, we have to correct the anemia.
The anemia.
Isn't it?
Yes.
By giving drugs that will build your blood. If the HB is too low, then you might need a blood transfusion.
Okay.
So we also do other tests, like even malaria test. If you find somebody has malaria, you treat malaria because it's also going to cause anemia. So if the patient is bleeding, then you have to sort out the cause of the bleeding. Yes.
Wow, that's quite interesting. It's good to know that, because I think it really costed her a lot of money, actually, based on how I saw her communicate. I used to just see her communicate her problems to someone close to me.
Yes.
And I was like, why are you really using this all money? And she was saying every now and then she had to boost her HB,
Her HB, yeah.
by taking a lot of, what do we call them? Those drugs that you do it, and
the iron tablets.
yes, and I mean it was good. And then she used to really inaitwaje kufura. I don't know why was that necessary. There was a time I saw her amefura uso, and then legs designing gine that was. This is not even pregnancy anymore. This is something different, you know. So I was like, why all these? And she told me, I don't know too. So she just kept going, and I'm glad that she went. The doctors did a good job, and she gave birth actually just recently. And
That's good.
Like, oh, that
so
is
when you
good.
have an issue with your body, that's why you talked about high risk pregnancy. You have to work with the doctor until the very
end.
Yes. So, but you see, there are some mothers who stay at home and they are not they are not consulting. But if you consult on time, the chances of reaching and the end of the pregnancy, it is possible.
It is possible.
Yes.
So these deaths that do happen with mothers and children, maybe during and after,
Yes.
they are all preventable.
Most of them are preventable.
Wow. I was looking at some observation done by, how would we call them, WHO, that is World Health Organization.
Yes.
And they were saying that 800 women, I think it was globally, there was a report done in 2015.
Yes.
800 women die daily because of high risk issues, stillbirth issues, and then women refusing to go for what do you call it, skill cared checkups. And I was like, if these things are prevented, that tells me that it is possible for them. Not really, I mean, it is possible for these many deaths to be prevented.
Yes.
So there is something, and I told myself, and if they are dying, that tells me there's something that is missing.
Yes.
Maybe in our society. I don't know, maybe it's skilled workers that we don't have. That one, I think you can just tell me about it. Do we have enough skilled workers? Do we have enough hospitals to really go about all these things? Because this death needs to be prevented from these mothers.
Yes, they need to be prevented.
They need to be prevented. That is what I told myself, because if doctors can confirm it can be prevented, then it should go about it. So what can you say really is happening behind the scene?
Okay. Okay, what we are saying is that you need to see your doctor, you need to work with the doctor until birth and even after birth. So, okay, maybe in our nation there are places where we have poverty.
Okay.
Poverty where people are not able to access medical management because of lack of money. Then you might go to places where the hospitals are away from the community.
Okay.
And that one can cause deaths because by the time the patient reaches the hospital, already something has happened.
Already something has happened.
Yeah, so we need to come up with a way that we are able to have many medical centers within the community.
Within the community.
Yes.
Wow. That is so encouraging. But that also tells me that there is also a gap between the rich and the poor, right?
Yes.
There is a gap. When it comes to prenatal care, there is a gap between the rich and the poor.
There's a gap.
A very
because
big gap.
apart from poverty, there are people who are not well educated. Lack of medical education. So you find some people waiting until the last. Actually, when you go to the village, you hear what the mother says. The mothers will say, no, me, I go to the clinic when my pregnancy is 8 months. So that's not correct, isn't it?
Yes.
So we are supposed to have medical education so that people knows when to go to the hospital when they are pregnant. You don't have to wait until you're almost delivering. That's when you're coming to the hospital.
Wow, that is
Yeah.
so good and so encouraging. So does it really mean that now, you being the skilled workers, do you have ways that maybe reach out to people in the villages for education purposes? Because I think they need to learn about this thing.
Okay, as you see, we are in town. So for the people around us, they are educated. Now the problem comes when you go to those remote areas. Because like here in our place in Ruiru, we have so many hospitals.
Which is so
We have
encouraging.
government hospitals as well as private hospitals. So nobody can be able to say, I did not have a good access.
Okay.
Yeah.
That is so good. Anyway, Daktari, that was so good to
Yes.
hear from you.
Yes.
And for now, time is over. We will come back again,
Thank
definitely, to hear from you.
Yes.
I've really learned a lot personally. I honestly didn't know much. Growing up, I only grew up as an only child. So my mother didn't have time to just sit down with me and help me understand these things, telling me when you grow up.
Yes.
And then when I went to school, I didn't enjoy biology that much. I don't know why. I think I thought it's hard. But I'm glad that you're here to help us.
Thank you.
To help the common mwananchi right there, the young people.
Yes.
Need to really understand all these things. Now let me know, how can people find here, get to know here? Because yes, Plainsview, it's in Ruiru, I know.
Yes.
In Kihunguro.
Yes.
Yes, that one, it's well explained. But do you have contacts for that? Maybe people to call here for purposes of such matters.
Okay. So as you have heard, we are at Plainsview Hospital, which is around Thika Highway at junction to Ruiru town. We are actually on the road, and you can find us. The customer care number is 0727 910 826. We are so many doctors working in the hospital. I'm not the only doctor, but I'm part of the team.
I love that.
We have all kinds of doctors with us. We have the medical officers, we have the gynecologists, we have even other surgeons. So we are okay.
You good?
Yes, so we are good. So when you come here, you'll find help.
So you do NHIF thing in the insurance? Or
Yeah, we have NHIF. And when NHIF is there, and also we do other insurances, so many of them. So when you come, you can inquire through that number to find out the insurance that you have, whether they cover your bills.
Your bills.
Yes.
I love that. So people are encouraged to come. So karibuni sana.